Thank you so much. Good day. Bonjour. Today, I want to talk about the healthcare crisis in our country. In Alberta, I visited and spoke with healthcare workers, and they shared stories of how in Calgary, at the Children's Hospital, because the demand is so high, there are trailers set up outside the Children's Hospital to deal with the excess demand. Children have died in Alberta or in BC, and in Ottawa, the Red Cross has had to be called in to children's hospitals. We are faced with a serious crisis. Parents are dealing with, and children are dealing with, agonizing wait times where having a child unable to breathe for any amount of time is heartbreaking. And that is something that parents are going through right now across the country. And we know that healthcare workers are burnt out, are pushed to the limit. These are people who care deeply about their patients, who care deeply about people, and are feeling like they're unable to do their work because they're so understaffed and under-resourced. We are at a breaking point. Things are very serious, and it's specifically for our children's hospital. Our children are at risk right now. Given how serious it is wrong that the Prime Minister of this country is not showing up to deal with this national crisis. Justin Trudeau has a responsibility to sit down with premiers and find a solution. First and foremost, that is the number one thing we're calling for. It's that given how serious this is, the Prime Minister needs to show up. If I was Prime Minister, that's what I would do immediately. Meet with the premiers, look for solutions. And there's a number of things we can do. We know that the solutions are going to require making sure we increase our recruitment, so more training of frontline healthcare workers, making sure that there are more spaces available, and that's something the federal government can help with. We need to make sure that if anyone in this country has international training in healthcare, they're able to work in that field. We can't afford not to have people in our country, or we can't afford for them not to be able to work. People who are trained in their fields need to be able to work in their fields. And finally, we need to make sure there's good pay. And the federal government made some commitments. Justin Trudeau made some promises. He should follow through with those promises to make sure people get a good, decent wage when it comes to healthcare. And there's a number of additional steps we can take, but fundamentally what we're asking for is, given how serious this is, the Prime Minister needs to step up, the federal government needs to step up and deal with this crisis. We have with us today a nurse from here in Ottawa who's going to share her experiences. And I think it's really important for us to listen very carefully to Rachel Muir, who's a registered nurse. And she's going to talk about what it's been like, how serious this is for patients coming to the hospital, for herself and her colleagues, how dire the situation is here in Ottawa in healthcare. Before I get to Rachel, I'll just do it in French, and then we'll have Rachel share her story. On a une véritable crise dans notre système de santé, c'est clair. Au Québec, à Montréal, les travailleurs de santé, les médecins, les infirmiers ont dit que c'est du jamais vu. On est dans une situation le pire qu'ils ont vu dans leur vie, avec les parents et les enfants désespérés, avec les travailleurs de santé qui sont fatigués. C'est vraiment une crise, c'est vraiment sérieuse et on doit agir. Si j'étais Premier ministre, je vais agir tout de suite. J'aurais dû répondre à cette crise immédiatement. Donc, le Premier ministre a montré un manque de leadership. Il doit faire preuve de leadership, rencontrer les premiers ministres des autres provinces et trouver des solutions. Primordialement, fondamentaux, ça c'est notre demande, que le Premier ministre doit montrer du leadership et rencontrer les premiers ministres pour trouver des solutions. Au lieu de blâmer les provinces, blâmer les premiers ministres des autres provinces, ce n'est pas un exemple de leadership. Ce qu'il doit faire, c'est de trouver des solutions. Et on exige le gouvernement de faire ça. On a avec nous, on est très fiers d'avoir une infirmière, Rachel Muir. Elle va partager son histoire, qu'est-ce qui se passe dans les hôpitaux maintenant, les histoires de ses collègues et les conditions pour les parents et les enfants et les familles qui rendent à l'hôpital. Donc, thank you so much again for being here, and I want to pass the mic now to Rachel Muir. Thank you so much for being here. Your story is going to be really important for people to hear. So thank you.
Thank you. I don't think people realize just how severe our crisis is. I have friends, colleagues, members of my hospital who cry before they come to work, cry when they leave work, because the workloads are so high. They are not providing the care that they were trained to give. We are morally injured, and it cannot continue. We need more nurses desperately. When you are waiting hours in any emergency, particularly when you're waiting with a child, when CHIO here was built to see 120 children a day and is seeing 110 in an hour, when you have to bring in the Red Cross, which is a disaster service, to help facilitate providing care to our children, what is it going to take for governments to realize that this cannot continue? Mm-hmm. Our most vulnerable are dying. In 2020, it was our elderly. In 2022, it's our children. Fortunately, we haven't seen many deaths, but how long is it going to be before it's a regular occurrence? And this is unacceptable. This is Canada. I'm at times I'm lost for words as to why people are not listening. We've been shouting about this loud and long, and now it's critical. It's beyond critical. I've said before we're at the bottom of the barrel, but we're not. We're beyond that. We're below the bottom of the barrel. We scraped the barrel and we've broken through. So I don't know. I personally am. We're tired. We're working endless shifts. I have coworkers who've worked 12 out of 14 shifts. It's a regular occurrence to work 16 hours instead of 12. Vacations are not being granted. All these things speak to a lack of personnel and a lack of respect, because we're expected to continue to do this. Children are waiting longer for surgeries than adults. They're waiting longer for surgeries than is healthy for them. Children, our CHIO ICU is at 200% capacity. We are sending children who are 14 and above to adult hospitals. These are not adults, these are children. This is stopgap measures that are not doing our children and their families any favors. It is impacting their health negatively. They wait longer for mental health services. They wait longer for care in the communities. They wait longer for assistance, for rehab, for physio, all the things that we take for granted. Why is this? This is not acceptable. These are our future generations. These are our future. And we are penalizing them because they are small and have no voice. And we're penalizing your healthcare workers because we are burnt out, we are tired, and we are morally injured.
Thank you so much for sharing. Thank you. Incredibly powerful. Thank you so much for sharing, Rachel. It's clear we need to act. That's the bottom line here. There can no longer be any finger pointing. The federal government's got to step up and meet with the premiers and find a solution. That's it. It can't be about waiting for someone else to give in a negotiation. This is about finding solutions immediately and then looking at the long term afterwards. We need to immediately solve this healthcare crisis, and we need to see some leadership. Donc, c'est clair qu'on doit agir dès maintenant. C'est une crise, et on a entendu une histoire tellement puissante de Rachel, et on doit agir, c'est clair. Before taking questions, I just want to add one additional point. For families, I know in addition to the healthcare crisis, people are really experiencing a lot of pressure because of the cost of living. And I just want to remind folks that as of today, the rental benefit that we fought for nearly 2 million Canadians qualify now for an additional $500. So if you are receiving the Canadian housing benefit, please make sure you apply for the additional support that is now available as of today. We're going to continue fighting for more supports, but that is something that is now available. With that, I'm ready for any questions you might have.
Good morning. Hi, Mr. Singh. Hi, Rachel. Thank you for sharing your story. Mr. Singh, Tessie Sanchi from Hill Times Research. I cover health specifically. I want to ask about what this impasse could, how this impasse could impact your supply and confidence agreement with the Liberals. And added to that, sir, out of the 4 points in, the healthcare points from the agreement, the healthcare spending is actually the least specific. There are no timelines. There's no call for legislation. It's just saying we need additional investments. Was that a lost opportunity? Should you have been more stricter in that agreement and saying, the premiers have been calling for CHT increases for 2 years now. Should you have been stricter in your agreement, said, we want a deal by such and such date?
So we made it a priority for healthcare to be in the agreement. That's something very important to us. And to start off with the first question, if we don't see action on healthcare, we absolutely reserve the right to withdraw our support. This is very serious. And we won't make that decision lightly, but this is at the level of seriousness that we could make that serious consideration. We need to see action. And I want to make it clear, just because we haven't seen it, we're not going to give up fighting. We're not going to let the Prime Minister off the hook. We have a tool that we can use to apply more pressure, and we're going to use that tool. We're going to apply pressure. We're going to demand action. There may come a time, though, it becomes clear to us that the Prime Minister and the Liberal government aren't willing to do what's necessary for people, and we will make a very difficult decision at that point. But right now, our focus is we're going to continue fighting. We're not going to back down. We made certain elements very clear because we knew that there were some clear deadlines and clear timelines for it. We knew that in healthcare in general, we wanted to keep it open and flexible because we know for healthcare, there's going to be changing circumstances. And right now, we need emergency relief for our healthcare system. This is not about one transfer to solve it. This is about a national crisis where healthcare workers are burnt out, children's hospitals are overrun, and there's not sufficient resources to deal with the crisis that we're going through. And that's going to require some immediate and urgent steps. And that is completely missing. There is no urgency. We don't see the Prime Minister acknowledging how serious this is. Premiers are completely ignoring how the crisis is hurting families. As Rachel pointed out, this is hurting our next generation. These are children. And I thought it's quite powerful how Rachel talked about children that don't have a voice to say, hey, we're struggling, like we're hurting. These are young children that don't have that voice. We have to be their voice, and we have to demand that the government act now.
And thank you for my follow-up, just very quickly. Are you essentially suggesting, I just want to be very clear on this, because what the impasse is, premiers don't want conditions to funding. The federal government, the federal Liberals want to see a plan. They want to put plans in for specific priorities. Are you essentially telling the government, just negotiate the CHT, get that done, don't worry about the conditions?
I'm saying that this seems to be a bit of a distraction. We got the Prime Ministers talking about, wanting to have conditions. We got the premiers talking about we want no conditions. And we got kids that are waiting for hours for care. Like none of that is relevant to a parent that has to wait 20 hours while their kid can barely breathe. None of that's relevant to a nurse that's working so hard and is unable to provide the care that they were trained to give. Like this is completely disconnected from the realities on the ground. That's the problem here. Like when you hear a Prime Minister say, of course we want to make sure the money goes somewhere important. We want to make sure the money that's committed to healthcare goes to healthcare. We understand the fears of people in Alberta. When you got Daniel Smith, who knows where the money would go? If you send money to Daniel Smith, no one knows that that's going to go to healthcare. Same thing for Doug Ford in Ontario. No one trusts that that's going to go to healthcare. I understand that. But that can't be an excuse not to act. When we saw the pandemic, we saw the federal government act immediately. When there was a crisis, we saw immediate action. That's what we need right now. This is not just about healthcare transfers. This is about an immediate crisis that requires immediate action and a Prime Minister to step up and show that leadership. And we haven't seen that so far. That's what this is about. And yes, we should be negotiating a better healthcare transfer. We believe that the federal government hasn't been spending enough in healthcare for decades, whether it's Conservative or Liberal governments. But right now, what we need to see is immediate solutions to dealing with an immediate crisis in our healthcare system as it pertains to children. That's what we need right now.
Mr. Singh, JP Tasker, CBC News. On the Canada Health Transfer, the premiers want Ottawa to pay about 35% of all healthcare costs in cash, not a combination of cash and tax points, because they transferred some tax points a few decades back. What's your position on that? Do you think that the Fed should spend 35% in healthcare costs?
We've long supported an increase in the transfer. The amount of the transfer, we're open to the Premier's ask. We're open to hearing if there's a counter proposal, if there's different ways to deliver that. But what we're talking about today is not just that we need to increase in a sustainable, long-term way the funding for healthcare, and acknowledging that the federal government has been cutting that funding for decades, and that we need to reestablish the federal government's contribution, and the Premier's demand to increase it is very legitimate. We support that demand. But what we're talking about in addition to that is the immediate crisis in children's hospitals. That is something that is in addition to the crisis of our overall healthcare system that has been starved of funding. But we need some immediate action to support the training of additional nurses and frontline healthcare workers. We need immediate action to unlock the workers that are in Canada with international training. We need to make sure we're paying workers a good and decent wage. We need some immediate action to deal with the crisis we're up against. But when it comes to the healthcare transfer, of course, we need to increase it. And we think the premiers have been really asking for something appropriate to increase that funding in a sustainable way.
Could I actually ask a question of Rachel?
Yeah.
Next. So you kind of painted a sad picture, dire straits, it seems like, in our healthcare system. What's your message to politicians who are bickering over conditions, they're bickering over a price tag of a health transfer? What do you say to them when you have the stories you have?
They need to sit down and actually listen to us and work with us, because we haven't had that from anyone, particularly my experience here in Ontario. We're not just we're not just fear mongering. This is happening, and we have the solutions. Some of them are short term because we need short term solutions to fix the crisis we're in currently, and some of them are long term to make sure that we don't end up in this crisis again. And a lot of it is to do with retention and respect, which we haven't seen any respect in healthcare for decades, and it's been blatantly obvious in the last 2-3 years. We're recruiting like mad and not retaining, so that's a problem. And we've lost nurses who never intended to leave their career at this point. But because of the untenable work conditions, because of the workloads, because of their personal burnout and moral dilemmas, they're leaving. So not only do we have valuable internationally educated nurses out there who are not working, we have valuable, experienced, knowledgeable nurses out there who are also not working because they couldn't keep it up any longer. When they're taking jobs in Winners and Costco instead of following a career, because that way they can get time off and they don't come home crying because they couldn't do what they needed to do for the patients they saw that day.
Good morning, Jeff Labine with iPolitics.
Yes.
You used words like crisis and it's at a breaking point. Do you think we've reached a level that this is a national emergency?
Well, it certainly feels like that. It certainly feels like that when we hear the stories. I mean, I think Rachel also highlighting what we pointed out, that the Red Cross had to be called into the Children's Hospital in Ottawa, and the Red Cross is only called in a disaster. So, I mean, it's disastrous. So we need to start treating it that way. And so far, that's not been the response of the federal government. And I think that's deplorable. Like, given how bad things are and how it's impacting our kids, I think, again, going back to Rachel, in 2020, it was our seniors. And we thought that was an alarm bell, like our aging loved ones who are also very vulnerable, who also don't have the most powerful voice, seniors in long-term care homes. They were the ones that bore the brunt of the pandemic. We thought, okay, never again. Let's respond to this. Let's do something to protect seniors and our healthcare system. And now it's our children. And again, no action. I mean, it's very serious. It is certainly a crisis, and it is getting to the level where it is a national emergency in terms of the treatment of children and the wait times and the potential for this to get worse. We're just at the starting point. It's also something to remind folks that this is the beginning, and as Rachel said, we've already scraped the barrel and broken through the barrel, and we're just starting. It's only going to get worse. The season has just started. We know that respiratory infections increase around this time of year, And it's only going to get worse if we don't act now.
And you're calling on the Prime Minister to meet with the premiers, but shouldn't this be handled by the health ministers?
Certainly, the health minister should meet. There's no question about it. But at a level, at the level of how serious this is, the ultimate responsibility, the buck stops with the Prime Minister. And given how bad things are, this is at the level where the Prime Minister needs to step up as well. And the health minister should certainly meet and have discussions, and that should be ongoing. But with a crisis, when you've got an emergency, when you've got a crisis, when it's national in scope, the Prime Minister has to show up. And given what we're hearing, given how bad this is, and given how this is impacting children, it is at the level where the Prime Minister needs to show leadership.
Hello, Mr. Singh. Mackenzie Gray with Global. I just want to clarify your position, because last week you said it would be irresponsible for you to trigger an election because there's a healthcare crisis now. On the weekend, you said that you reserve the right to withdraw judgment, and now you've doubled down again on that. Are you putting the Liberals on notice that you're going to be pulling the rug out from under them if they don't act on healthcare?
I want to be clear on this point. I think it's a good point. I'm absolutely ramping up pressure because this is serious, and the lack of action is really troubling. And so I want to make it clear that this is serious, and we are purposely making sure that that pressure is being felt and that we take this very seriously. We also take the decision of calling an election very seriously. That's not something we're do lightly. My focus now is to fight, is to not give up fighting. My focus now is to use the power that we have to get action. My focus now is to raise awareness, to have stories like Rachel's come forward so that we can paint the picture of how dire things are, and we can demand this government act. I've been asking questions in question period to demand the Prime Minister to act. Right now is the time to fight to see action happen. And that's our focus. Right now, that is our focus. That's our attention on getting this government to respond to the crisis. We reserve the right, though, if it becomes clear that the government's simply not willing to act on this, we are open to a very serious decision and looking at that down the road. But right now, our focus is on making sure we get this government to act, and we use every tool possible to ramp up the pressure on the needed action to save our healthcare system, to help kids right now that are struggling, and to support our healthcare workers.
But I'm just trying to get to the bottom of it. Tuesday last week, it was irresponsible for you to pull the rug out. Now you seem like you're changing your tact. Are you changing your position here? Yes or no, clearly on that. Is it still irresponsible to have an election right now?
Having an election is a very serious decision, and that doesn't change. Having that would be something very difficult to do. It would put the country into an election where we would not be able to get any action done. So I think that's very serious. And in the midst of a crisis, yes, of course, it's something that I take very seriously. It's not a decision I would do lightly, and it is not my focus. My focus is not on how do I find a path to triggering an election. That's not my goal. That's not my focus. That's not what I want to do. I always have the ability. Our team always has the ability to withdraw our support. That remains an option. We always have that option. It's an option we take very seriously. We don't take it lightly. And in the midst of a crisis, that would have serious repercussions, and we understand that. We reserve that right, but our focus right now is not on triggering an election. Our focus right now is to get the government to understand that we want to have the Prime Minister understand just how serious this is and that action is required. That is our focus. Our focus is on fighting. Our focus is on getting action. Our focus is on making this Prime Minister understand how serious this is and that he needs to show up. That's our focus. That's our priority. And if it comes to a point where we've exhausted all options and we've exhausted all our attempts to get some action and this government's not acting, we reserve the right to withdraw our support.
Et nous avons une question en ligne. Raymond Filion.
Oui, bonjour, M. Singh. Justement, à ce sujet-là, quel geste concret vous demandez au gouvernement Trudeau, à défaut de quoi vous seriez prêt à déclencher les élections, à retirer votre appui au gouvernement? Qu'est-ce que ça prend?
À ce moment, ce qu'on demande le gouvernement de faire, c'est de rencontrer les premiers ministres pour trouver des solutions. Donc ça, c'est notre demande. On veut voir d'action pour reconnaître qu'on est dans une crise. Et une crise que Rachel a partagé des exemples, comment c'est sérieuse, comment les parents, les familles, les enfants sont désespérés, comment les travailleurs sont aussi désespérés, et comment on doit avoir le Premier ministre faire preuve de leadership, de rencontrer les Premiers ministres, d'essayer de trouver des solutions. Ça, c'est notre demande. Et si, après nos efforts, parce qu'à ce moment, on se bat pour les gens, on met l'effort, on essaie de trouver des solutions. On essaie de mettre la pression sur les épaules du gouvernement, des libéraux, du Premier ministre d'agir. Et s'il n'agit pas, et si après tous nos efforts, c'est clair que le gouvernement ne veut pas répondre à cette crise, on a toujours le pouvoir de retirer notre appui, mais à ce moment, c'est le moment de lutter, c'est le moment pour la bataille, pour forcer ce gouvernement d'agir. Et ça, c'est notre priorité. Pour prendre au sérieux le pouvoir qu'on a, de effectivement retirer notre appui pour faire déclencher une élection, c'est une décision qu'on ne prend pas légèrement. C'est une décision qu'on va prendre avec toutes les responsabilités que ça prend. Et c'est maintenant le temps de continuer de mettre la pression pour voir d'action parce que notre but, c'est de sauver les vies, c'est de sauver notre système de santé, c'est d'aider les travailleurs, c'est d'aider les enfants. Ça, c'est notre but. Notre but, ce n'est pas de faire déclencher une élection. Notre but, c'est d'améliorer la condition des gens.
Et vous vous donnez jusqu'à quand? À quel moment, là? C'est quoi votre échéance?
Ça, c'est au gouvernement à ce moment de montrer s'il veut agir. C'est au gouvernement de montrer s'ils vont prendre au sérieux cette crise. Donc, on va continuer de mettre la pression et on va continuer d'analyser la situation. Et pour le moment, pour moi, c'est le temps de reconnaître les histoires des travailleurs. Les infirmières qui partagent comment ils pleurent avant de travailler et quand ils quittent la journée, parce que c'est difficile. Les enfants qui ne peuvent pas respirer, le fait que la Croix-Rouge était appelée à Ottawa. Donc, c'est maintenant le moment de partager ces histoires, de montrer que le gouvernement doit agir et d'utiliser notre pouvoir pour forcer le gouvernement d'agir. C'est le moment de faire ça.
Just one more question, Mr. Singh. You said earlier that the provincial demands are appropriate. The core demand of the provinces is that the feds give them a bunch of new money, no strings attached. Then you subsequently said that you can't trust Daniel Smith or Doug Ford to spend that money on healthcare. So which is it?
The demand of increasing funding is something that I think is appropriate, not the no strings attached. I've always said that Canadians expect that the money should go towards healthcare. I've always said that. I maintain that. That's never changed. But the core demand of saying that the federal government needs to step up, that's something that we've long called for. We've campaigned for it numerous years, saying the federal government has not been spending adequately on healthcare. And so clearly our message has been very consistent that we need to see an increase in funding. And the Premier is demanding for an increase in funding. I've stood with John Horgan when he was Premier to say, yes, absolutely. Premier Horgan's demand for increased funding is appropriate. The federal government hasn't been spending enough to protect our healthcare system, to invest in healthcare workers, to provide the best care possible for patients, and to make sure kids aren't struggling to get access to care. So we've long said that the funding should increase. We support that. And we've always said that making sure the money goes to where it's intended to go to, that it goes towards healthcare. That has always been our position.
Just one final question, if you're okay. The federal government conversation with the provinces about the funding is not about whether or not it goes to healthcare. The agreement is that it should go to healthcare. It's about whether or not that funding is directed towards things like long-term care, mental health, or having agreements to share data. So do you support that the federal government shouldn't give any money over the provinces unless agreements on those topics are part of that deal?
The fundamental question around making sure the money goes to healthcare is to make sure that it's spent in a way that is in line with the Canada Health Act. That's what we're really concerned about. We see premiers that are spending money on privatizing our healthcare system and that our public dollars are going towards lining the pockets of private companies. That's a big problem. That's going to cut care. We've seen examples of that in the long-term care sector where public money went to for-profit long-term care homes where the military came in and saw they were the worst conditions that they've ever seen. These are hardened military, Canadian Armed Forces, that went into seniors' homes and said, we haven't seen worse conditions in war. That was in for-profit care. So we're deeply concerned about that. We want to make sure that there's good accounting, that when we're spending money on healthcare, that it's going towards healthcare that follows the Canada Health Act principles. And those are some important requirements to make sure it's public, that it's public administered, that it's universal. And there's some deep concerns with people like Daniel Smith and Doug Ford who don't share those values, who've opened the door to private model of care which would increase profits for companies, but wouldn't increase the care for our loved ones. So these are things that are really important. But ultimately, all that, while very important, doesn't change the fact that we're in a crisis. And at this point in time, the Prime Minister just has to step up and start looking for solutions to deal with the immediate crisis in front of us. And of course, we've got to deal with the long-term problems in our healthcare system. And those continue to be really important. But with a crisis that we're up against, that can't be the barrier for action to solve the problems that we're seeing in our children's hospitals across the country.
I'll let my final question be for Rachel, if that's all right.
Yeah.
Rachel, as you said, you're actually in the hospitals. You're where the politicians aren't really going. There are so many problems right now. A lot of them are going to take a long time to fix. You acknowledge that in your statements. What are some of the short-term, quick fixes that would help professionals like you feel better about going into work and doing your job? The things that they can do quickly.
The biggest thing is we'd like to see a lot more respect. So, because we haven't seen that. But short term, we need to look at better remuneration. We need to look at ways of bringing back those nurses that we've lost recently, get them back to the bedside, because not only are they paramount in caring for our patient populations because of the skill set and the knowledge base they bring with them, they're also paramount in mentoring and supporting our new nurses. Because I think what people fail to realize is that we're not just losing nurses of my generation who have just said, well, I'm close to retirement anyway, I'm out of here. We're losing nurses who are 1 or 2 years into their career. I know of nurses who have come to institutions, and in my institution as well, and they haven't even made it out of their orientation because they've seen what they're going to be faced with. They don't have support. They're going to be working literally all the hours there are. And they're not willing to sacrifice their mental and physical health for that. So we need to bring people back so that we can support people. And then we need to work on keeping them.
Thank you, Missy. Oh,
Can I just squeeze another one in?
Yeah, sure.
It's actually on another topic.
That's
Tiff Macklem is speaking to reporters later today at his year-end press conference. I know your friends in Labour have been critical of his fight against inflation, consistently raising interest rates. What do you want to hear from the Governor of the Bank of Canada later today about the fight against inflation?
A couple of things that I want to raise. You know, one of the points that I made in committee directly to the Governor of the Bank of Canada was my concern that he was quick to raise concerns about wages. He made a comment about employers not increasing wages, and for whatever reason, he weighed in on the question around wages, saying that this inflation won't last for long, or employers shouldn't increase wages, and has been completely silent on profits. When we talk about the inflationary crisis we're going through, this isn't a wage-based inflation, and there's lots of economists that have pointed out we're not in the past. We saw clearly wage-driven inflation. Wages were high, and it was driving up demand. But that's not what we're going through right now. We know exactly what we're going through. We know that there's a war going on, and that war has created certain conditions. It has increased the cost of energy because of the war, and that has driven up the cost of a lot of things. And we also know that corporate greed is driving up the cost of things. So for the Governor of the Bank of Canada to weigh in on wages but say nothing about the corporate greed, to say nothing about the massive profits, is problematic. It is a clear bias. And what we have is a liberal and conservative, the Liberal government and Conservative Party, who are also unwilling to actually talk about one of the real problems that we're going through. The cost of living is up because the price of goods are up, because corporate greed has driven up the cost of things. And no one is willing to tackle that problem, to look at solutions towards dealing with that. While in other countries around the world, that has been something that's been dealt with. We've seen the European Union put in an excess tax on the profits of oil and gas companies. We've seen the United Kingdom take similar steps. Spain take similar steps. So we wouldn't be leaders in this. We would actually be supporting some major countries in major the European Union that has actually understood that there is corporate greed that is driving up the cost of living. In fact, we saw the CEO of Shell himself say that government should tax energy companies at this time, given the massive profits they're making, and use that to help people with the cost of energy. So that's one thing I want to see. I also know that in the mandate that the federal government sets, it's not just about reducing inflation. It also includes a provision around making sure we have maximum employment. And that is something that I'm worried about. If the steps that the Bank of Canada are taking are going to sharply and quickly increase the interest rates to the level that it's going to cause a recession in Canada and cause the loss of jobs, well, that's also a major problem. And fundamentally, this all comes back to the Prime Minister, because the Prime Minister is allowing the only response to inflation be the Bank of Canada increasing interest rates and not taking any fiscal policy decisions to actually lessen the blow of inflation, to find ways to deal with the cost of living that don't require the singular solution of increased interest rates, then it's the Prime Minister's fault for not stepping up and doing enough to deal with inflation. And I'll have you recall, his first response to the inflation when we were asking questions was, it's not our fault and it's worse in other countries. That shows a lack of understanding of what people are going through. And so that would be a bit of a long-winded summary of what I would expect the Bank of Canada to weigh into and what the Prime Minister should be doing. Thanks. Merci. Did such an awesome job.